Okay.
All right, Kelly, great work today at clinic. Just a few things that we can focus on. Just next time being a little more clear when describing the exercise. I know there's a lot going on with the patient, but just being a little bit more clear, because there was a time when we were trying to do posterior pelvic tilts. I know it's a difficult exercise to try to explain to a patient, but just finding an easy way to explain it so that they can easily understand it.
Okay.
The next thing, just being able to pick up nonverbal cues. We're performing an exercise or manual therapy with a patient, because the patient kind of noticeably was in a little bit of pain. Just being able to pick up on their nonverbal cues, knowing when to maybe back off a little bit, would be good. And then lastly, I think you did a really good job on asking appropriate questions to the patient, especially following up with even more in-depth questions to get to the bottom of things. I thought you did a really good job on asking appropriate questions.
Thank you.
Yeah.
I appreciate it. Okay, so I have a couple things I want to tell you about, I guess.
All right.
The first thing is I think you could encourage the patient a little bit more. I felt like sometimes there are a couple of awkward silences. It might be me because I talk a lot, but I felt like maybe when you were doing STEM with one of the patients, you could have been a little bit more talkative, a little bit more encouraging to help get that patient, excited.
Oh, yeah.
Another thing is you could be a little bit better with your time management. So I saw that sometimes you would kind of let the patient keep talking, which is awesome because you need to get to know them, but I also think that maybe you could talk to them while doing their exercises, because time's really important when you're in the clinic and you have to make sure that you get everything done within the certain time allotted. But one thing you did a really good job at, which I didn't do a good job at, was explaining exercises. You were always clear, you're always concise, and the patient always knew what you were trying to say. So I admire that, and I thought you did a really good job at that.
Well, thank you.
Yeah.
Sounds great. Good work.
Thank you.